Next, we're going to talk about the first part of the digestive tract or the alimentary canal, which is the mouth or the oral cavity. The mouth is responsible for several of the functions we talked about in the last video, including ingestion of the food. Food comes into the body through the mouth. It's where mechanical digestion begins, or mastication or chewing the food, which is breaking the food up into smaller pieces, increasing the surface area so that the enzymes have a are better able to get access to the food and break it down, prepares the body for chemical digestion by breaking it down, and also with the salivary glands emptying into the digestive system, there's chemical digestion that occurs here. So the parts, as you can see in the diagram, include the cheeks, which are the side walls of the oral cavity, the lips, which close the front or the opening to the oral cavity with the orbicularis aureus muscle, the tongue, which has got the taste buds we talked about in the nervous system for tasting the various chemicals in the food, but also moving the food through the digestive process in the mouth, moving around so it can be chewed, and then moving it to the back of the throat so it can be swallowed. The palate, the hard and soft palate, which forms the roof of the oral cavity, but also the base of the nasal cavity. We'll talk more about that when we get to the respiratory system. And the uvula, the little thing that hangs down in the back of your throat. It closes off the opening to the nasal cavity when you swallow your food. So the tongue, so we're going to talk today about the mouth. The mouth is the first part of the alimentary canal or the digestive tract, and it is where food enters the digestive tract. That's ingestion of your food. It's where you chew your food up. That's a form of mechanical digestion called mastication. And the purpose of that, it breaks the large pieces of food into smaller pieces of food to increase the surface area so the enzymes that break down your food chemically can work better. It also prepares the food for chemical digestion, basically through the mastication process. It also mixes it with the saliva, which is some chemical digestion, and forms the bolus, which you're going to swallow eventually. So the parts you can see are the cheeks, the side walls, the lips, the opening, the tongue, the palate, hard and soft palate, and the uvula. And we'll talk about each of these just a little bit. So the tongue, we've already talked about once before. It's where most of your taste buds are located, which detect the chemicals sweet, sour, salty, bitter, and umami in your food and play a role in the taste of your food. It moves the food through the oral cavity as you chew the food up through mastication. It also forms the food into a ball of food and saliva called a bolus, which is pushed to the back of the mouth into the pharynx where you swallow it. The palate, and there's a hard palate, which is bone, as you can see, and a soft palate, which is connective tissue. And those two structures together form the roof of the oral cavity, but also the floor of the nasal cavity. Again, you can see that in the diagram. And at the back of the soft palate is the uvula, and that's that little thing that hangs down in the back of your throat. You can see that when you open your mouth. The uvula, when you swallow, closes off the opening to the nasal cavity so the food and stuff don't go up your nose. In your mouth you have your teeth, and there are two sets of teeth, primary and secondary, or sometimes the primary teeth are called deciduous teeth because you lose them like a tree loses deciduous leaves in the fall. Sometimes we call these the baby teeth as well. So the primary teeth, there are 8 incisors at the front of the mouth, which are for cutting and tearing food. 4 cuspids, which are kind of a combination between an incisor and a molar. And the 8 molars, which are more for grinding the food. And you can see in the skull there, you can see the baby teeth and the secondary teeth further up in the jaw. So over a period of time, a person will lose their primary teeth, and as the secondary teeth grow, and push the primary teeth out and replace them. So you can see we've got several sets of incisors. We've got 4 on the top and 4 on the bottom. Again, they're for cutting and tearing food, primarily meat. You have the bicuspids, 2 on the top, 2 on the bottom, or sometimes those are called the canines or the eye teeth. You have the bicuspids, which have a couple of ridges on them, or cusps, or premolars are called. There's 4 of those in the top and 4 of those in the bottom jaw. And then you have the molars, and there's 6 on top and 6 on the bottom. The last set of molars, sometimes called the wisdom teeth, we think that maybe through evolution we may start to lose these as our diet has gone from more of a vegetable-based or plant-based to a more meat-based diet. The jaw is becoming more and more narrow, and many people don't have room for those wisdom teeth and have to have them removed by an oral surgeon at some point so they don't cause the other teeth to go out of alignment. The salivary glands, and there's 3 sets of them. You can see in the diagram the parotid gland is up in the angle of the jaw near the ear. And then in the lower jaw, below the tongue, you have the sublingual and the submandibular salivary glands. And these produce saliva, which is carried by a duct into the oral cavity where it mixes with the food, forming the bolus, which helps to lubricate the food, make it stick together so we can swallow it, but also contains enzymes that help digest our food. So let's talk about saliva. Saliva, like I said, helps moisten the food particles, helps hold them together to form the bolus, and begins the chemical digestion of carbohydrates with an enzyme called salivary amylase. Amylase is an enzyme that breaks carbohydrates down. It also helps keep the mouth clean, helps cut down on bacterial growth, which can cause plaque and bad breath and things like that. Like I said, we already went over the parotid gland, the submandibular glands, and the sublingual glands. And you got 2 of each, 1 on each side of the face. And finally, the last thing we're going to cover today is the pharynx, or sometimes we would just call this the throat. It connects the nasal and oral cavities to the larynx and the esophagus. So nasal cavity used to connect to the larynx. We'll talk more about that in the respiratory system unit later. And the oral cavity connects with the esophagus, which is the tube that carries the food down to the stomach. You can see there are 3 parts to the pharynx: the nasopharynx, the oropharynx, and the laryngopharynx. Nasal at the top, oral at the bottom, and laryngopharynx at the bottom near the larynx. The oral cavity is kind of where the food and air pathways cross. You also have your tonsils, which are part of your lymphatic and immune system. And you can see in the diagram there we've got the lingual tonsils and the palatine tonsils labeled. You also have the opening to the auditory tube, or the eustachian tube. We talked about that. That's what connects the middle ear to the throat and helps equalize the pressure on both sides of the eardrum, especially when you have a change in elevation. It also helps drain any fluid that might get in the middle ear, help preventing ear infections.